stars fill the evening sky. Without a sensing, life is passing by. So if you want a solution, my friend.
Assalamu alaikum. Welcome back. You're watching Raising Children. This week's subject is dealing with the whole spectrum of medicines and nutrition and looking after the small child. We have with us in the studio pediatrician Dr. Nadeem Ahmed Khan. Assalamu alaikum. Welcome to the show, Doctor. It's very good of you to give us your time like this and discuss some issues. Now, in the previous program we had a lady who said that if the woman can't breastfeed, then she should go for one of the formula milks. I mean, how do you look at it as a pediatrician?
Bismillah ar-Rahman ar-Rahim. First of all, regarding breastfeeding, it has been unanimously agreed upon that the best gift a mother can give to the baby is the breast milk.
In fairness, she did say that.
Right. But many parents, they're like half-hearted. They start off with the breastfeeding, and then they, after a few months, either because of either they're working or because of some misnomers, they don't continue the breastfeeding, and then the child goes on to the formula milk. When we discuss this issue with our parents after the delivery of the baby, we divide this breastfeeding into 3 phases. The first phase is right from the birth up to 6 months, and we recommend the mothers to exclusively breastfeed. And what do we mean by exclusive breastfeeding is that no water, no juices, no add-on nutrition except for the breast milk.
Only breast milk.
Only breast milk, starting from birth up to 6 months. And when we say starting from birth, as we know that the baby after the delivery for 1 or 2 hours is awake, and that is the best time to initiate the breastfeeding, right after delivery. Because those parents who have experienced this, they know that baby after being awake for a couple of hours goes to sleep, and then usually babies sleep for about 22 to 24 hours even a day unless you wake them up. So what happens is that when you start the breastfeeding, then you can easily continue on. And very important thing to remember is that during the initial 2 to 3 days, the supply of the breast milk is quite less. When we say less, we don't really mean in absolute terms less, but this is sufficient for the requirement of the baby. This is what they require.
Later, doesn't it?
This is what they require in first 2 to 3 days, and the quality of the milk is different in 2 to 3 days, which is called colostrum, which is high in fat.
Colostrum, yes, that's right.
So what happens when the feeding is begun and the supply is less, as the mothers are expecting right from day one, plenty of supply which doesn't happen, then they get disheartened and they say that my breast milk supply is not sufficient and my baby is not passing urine. Then at that time they go to the bottle, and this is the recipe for breast failure.
Well, let me tell you that my wife, when she was in Philippines, her first child, we have children from previous marriages, her first child, she experienced exactly what you're saying. And there was a person from the formula company in the village who was telling the people, look, your milk is very low, your baby's not going to thrive, better you go on to the formula. And, they made a sale.
That's exactly what happens. Yeah.
So it's evil, isn't it?
It is. So we tell our mothers always to insist on breastfeeding. Practically speaking, for all practical purposes, there is no reason for not giving the breast milk. There are very, very few circumstances where breast milk is harmful, but those we should not mention in public. These are very specific circumstances which the doctor should discuss with the parents. We should not give a message to the public that there are even certain circumstances where breastfeeding is harmful. And one of those is a very rare condition called galactosemia. If the child has that condition, the lactose, which is plenty in the breast milk, is harmful for the baby. Other than that medical condition, there are no absolute contraindications to breastfeeding.
So there are very, very few women who don't have enough.
Let's say a mother is taking chemotherapy, and that chemotherapy goes into the breast milk. But these are, again, very unique circumstances which should not be discussed with the parents when we are counseling the parents. These are for doctors to decide.
Well, they're so rare that they're hardly worth bothering about. Yes. What about the incidence of water? Here in this hot country, sometimes mothers, they like to give a little teaspoon of water. They see the child is thirsty.
There's another thing, a lot of parents, they ask us, the breast milk is a complete nutrition during first 6 months. There is no need to give water or any juice.
It's complete.
It's absolutely complete milk or complete mode of nutrition during first 6 months. And after 6 months, when you introduce for your baby something semi-solids and you go on to the solids, still you should continue the breast milk, breastfeeding until 2 years of age. That's the recommendation from WHO, and our religion tells us that the feeding should be continued until 2 years.
2 years, that's right. Did you hear in our previous program when we discussed with the nutritionist about feeding solid foods? Would you be in agreement with what was said?
Yeah, basically the solid foods are offered after 6 months, and it takes few days to few weeks for the child to be used to tasting those foods and be liking it. Parents have to be patient that time, and the introduction should be very progressively, slowly, so that the child does not get a feeling that you're forcing the child to feed. The best thing for the child to have is, although the child is very young, maybe 9 months or 1 year of age, and a lot of our parents think that they have to force their mode of feeding to the child, how much they want, they should give to the child. But that may not be the right thing to do. You have to trust the child. When the child gives you clues the child is hungry, give the feed. When the child gives you clues that the child is full, stop feeding.
That's right. I mean, I remember my mother had her mother, my grandmother, around when children were there. When I was a little boy, I remember my brothers and sisters. She would always give her advice like that. You know, if the baby's hungry, he'll eat. Don't worry about him.
That's right.
If he leaves the food, it means he's not hungry. You don't have to hold his nose and force feed him like a goose.
Especially in Asian countries, we have a lot of mothers. They come to us and they complain that the child is not eating, and we always ask the first question, do you force the child to eat? They say sometimes. When you further probe them, even up to the extent that they have, out of love, obviously, they have beaten the child for not eating. And that's counterproductive, obviously.
Of course it is.
You're playing with the psychology of the child, and the more you say they eat, the more the child will say, I'm not going to eat. So it's like a vicious cycle, you know, you're entering into.
Right.
It's like a kind of a cold war going on between the two. So the confrontation should not start between the mother and the child.
Obviously, this relationship in this very young age should be warm and friendly and easy. Otherwise, the child must suffer. Give us some more advice from your experience as a pediatrician, problems or lack of understanding. What about the umbilical cord?
Yeah.
You know, some people have these funny ideas.
Right. The umbilical cord is at the belly button. It's like a communication between the mother and the fetus when the child is in utero. But when the baby is born, the obstetricians cut the cord, and the stump, some of the cord is left over. And most of the children, when they go home with the cord stump already there.
Yes.
Common myth is that don't give the child a bath unless the cord falls off, which is not scientific at all. It has nothing to do with bathing. If it gets wet, just dry it, keep it clean and dry. Some people apply antiseptic cream so that it remains healthy. There's no need for applying any cream or any antibiotic powder or ointment. Just simple, plain, keep it dry and clean. It will fall off by about a week or 10 days of age. And then everything goes smoothly and there is nothing wrong with it. Sometimes the babies bleed from there. If the bleeding is very like a spotting on the diaper, they don't need to worry about it. But if the bleeding is a little bit more, they need to seek advice from the pediatrician.
Right, right. So any kind of heavy bleeding like that, please consult your doctor as soon as possible. We've come up to the break time now, Doctor. Thank you very much. We're going to take a short break. We'll be back after the break. You're watching Raising Children, and we've been discussing this week about nutrition and the various problems that parents face with the young child back from the hospital. Assalamu alaikum.
Like every sunrise that brings forth each day.
Assalamu alaikum and welcome back. We've been talking about the umbilical cord, about nutrition and various other things. Doctor, did you hear in our previous program when we discussed with the nutritionist about feeding solid foods? Would you be in agreement with what was said?
Yeah, Basically, the solid foods are offered after 6 months, and it takes few days to few weeks for the child to be used to tasting those foods and be liking it. Parents have to be patient that time, and the introduction should be very progressively, slowly, so that the child does not get a feeling that you're forcing the child to feed. The best thing for the child to have is, although the child is very young, maybe 9 months or 1 year of age, and a lot of our parents think that they have to force their mode of feeding to the child, how much they want, they should give to the child. But that may not be the right thing to do. You have to trust the child. When the child gives you clues the child is hungry, give the feed. When the child gives you clues that the child is full, stop feeding.
That's right. I mean, I remember my mother had her mother, my grandmother, around when children were there. When I was a little boy, I remember, my brothers and sisters. She would always give her advice like that. You know, if the baby's hungry, he'll eat. Don't worry about him.
That's right.
If he leaves the food, it means he's not hungry. You don't have to hold his nose and force feed him like a goose.
Especially in Asian countries, we have a lot of mothers. They come to us and they complain that the child is not eating, and we always ask the first question, do you force the child to eat? They say sometimes. When you further probe them, even up to the extent that they have, out of love, obviously, they have beaten the child for not eating. And that's counterproductive, obviously.
Of course it is.
You're playing with the psychology of the child, and the more you say the eat, the more the child will say, I'm not going to eat. So it's like a vicious cycle, you know, you're entering into.
Right.
It's like a kind of a cold war going on between the two. So the confrontation should not start between the mother and the child.
Obviously, this relationship in this very young age should be warm and friendly and easy. Otherwise, the child must suffer. Give us some more advice from your experience as a pediatrician, problems or lack of understanding. What about the umbilical cord?
Yeah.
You know, some people have these funny ideas.
Right. The umbilical cord is at the belly button. It's like a communication between the mother and the fetus when the child is in utero. But when the baby is born, the obstetricians cut the cord, and the stump, some of the cord is left over. And most of the children, when they go home with the cord stump already there.
Yes.
Common myth is that don't give the child a bath unless the cord falls off, which is not scientific at all. It has nothing to do with bathing. If it gets wet, just dry it, keep it clean and dry. Some people apply antiseptic cream so that it remains healthy. There's no need for applying any cream or any antibiotic powder or ointment. Just simple, plain, keep it dry and clean. It will fall off by about a week or 10 days of age. And then everything goes smoothly, and there is nothing wrong with it. Sometimes the babies bleed from there. If the bleeding is very like a spotting on the diaper, they don't need to worry about it. But if the bleeding is a little bit more, they need to seek advice from the pediatrician.
Right, right. So any kind of heavy bleeding like that,
right.
Consult your doctor as soon as possible. Doctor, you have a lot of patients, obviously, that you see. Could you tell us about some more common problems that you face?
Yeah, I would like to mention something that these days, because of the shortage of beds in the hospital globally, and because of the insurance companies pushing for early discharges, all the hospital deliveries, the push is now for early discharge for the mother and the baby. And many hospitals have a policy of discharging a baby at 24 hours of age. Now, that is a time when the baby is undergoing a transition. And that transition has to be smooth and be observed by the medical community. So when the baby goes home after 24 hours, especially for a mother who is a first-time mother, prima gravida, they're not well aware of what the problems they could face. So they need to be in communication with the doctor. So a very important thing is that after they go home, within 24 hours, they need to come back to the pediatrician or a doctor after 2 to 3 days.
That's right. I've noticed with a lot of my friends and neighbours that this appointment is ignored. They say the baby's okay, why bother him?
Actually, most of the babies will be okay, but if there is a problem, then you'll not be able to recognize as a parent. And these days, you know, family system is not like the elders are in the household. They may not be able to identify the problem for the first-time mother, and a lot of times she's living alone and she doesn't have any help from her mother or her grandmother. So that's the time when they need to seek help. And some things that they can be benefited with if they go to the doctor is the identification of jaundice. There are certain murmur in the heart can be picked up at that visit. The pediatrician can look into the weight gain if it is appropriate. And that is a time when mothers can go and discuss any problem if they have regarding the breastfeeding or any other issues.
What exactly is jaundice and how common is it?
Yeah. Jaundice is the yellow discoloration of the skin. Almost every baby within the first week or 2 weeks has jaundice. About 80 to 90% of the babies have jaundice. Clinically significant to be seen in the eyes and then in the skin.
How serious is it?
Usually it is not, but under certain circumstances it can become serious, especially if the blood groups of the mother and the baby are different. Then there are some antibodies which go to the baby and they can cause the destruction of the red blood cells to cause more jaundice. And it can go high enough to enter the brain in a significant concentration and can cause brain damage. So this is one of the things which is, we know as medical community what can go wrong and we know how to deal with the problem. It's just that we need to identify the problem. If the mothers will stay home and will follow the advice of non-medical community, they might miss a high bilirubin level and then that might enter the brain and cause the damage.
Wow, that's very serious indeed.
It's a very serious thing. It is not common, but it can happen to any child. So that's why it's very important when the mothers notice that the child is yellow or more yellow than when they came back home from the hospital, they need to seek advice. It's better to go to the doctor, have the blood test done if the doctor feels so, and at least you're safe than sorry. One of the other things regarding jaundice is many mothers feel that if the child has jaundice, they'll put under the sun.
Oh.
Of course, sunlight is helpful for the jaundice, but not for 10-15 minutes.
No, of
it
course
has to be
not.
prolonged. And in hot countries, it's not practical for babies to be under the sun for a longer period of time. So practically speaking, we don't advise the mothers to put the babies under the sun. And obviously, if you show the face to the sun, it has no value. It has to be almost the whole body. And we don't recommend putting the babies unclothed under the sun for a little longer.
Of course not. Their
So
skin is so delicate.
of course. So that's something we tell the mother, practically speaking, there is no role of sun exposure in jaundice. If the child has a problem with yellow discoloration, he needs to go to the hospital.
You know, perhaps, I'm sure you must, that in the West there's been a movement of home birth, and that especially for multigravidas, women who've had many babies, several. What is your definition of multigravida?
Yeah,
Two or more
multigravida
children?
will be two or three or more children.
Yeah, right.
Yeah.
Right. Especially for these women, no objection is raised, and a midwife is provided, and the woman has the baby at home. Several of my children were born that way in England. What's your opinion on
See,
this?
my perspective to this is that birth is a natural process. Wherever you are, it will happen. And most of the times, it goes smoothly and naturally. The role of the hospital is in identifying a problem in case there is a problem. And that is obviously not a common thing, but we need to be around the medical community to seek help if there is any need of help. It's just like putting a seat belt. If somebody will not put a seat belt, usually you're not supposed to have accidents. So if somebody will not put a seat belt the whole life, he may go without an accident, inshallah, and then nothing go wrong. But the seat belt is provided for a possible or a potential scenario where you have an accident and you can be protected from it. So it's just something like this. Home births are okay, but they're not advised these days. And one of the things is, as we just mentioned, that we don't have mixed family system any more common. Many mothers are at home alone. The husband and wives, they are in their household, and the lady has no support at home. That was very much practical in good olden times.
She had aunties.
The aunties and the grandmothers are available and they're experienced. So here if you're asking a mother who's a primary gravida or even a second time mother, it's a lot of stress.
First time mothers in Britain, they strongly advise a hospital birth. For example, I'm a hospital birth. I was the first one. But my subsequent brothers and sisters were all born at home, except for the very last one, who was a menopause baby. We say, that after the birth, the woman entered menopause. So there were no difficulties, but it is exactly as you say, that there were aunties and the grandmother and neighbours and women who had a lot of experience because they had also had home births. You don't have this these days, do you? People know about computers but not about births. Yes. What when a woman lives a long way from a hospital? Like my youngest son, I delivered him myself in a farmhouse in Ireland because the nearest hospital was 30, 40 miles away.
I know a couple of my friends, they have delivered either in the ambulance or in the car, and I can tell you it was a very traumatic experience for them because we are not the same as we used to be. So that's another thing, if the husband has to conduct a delivery, if you ask someone who is currently living in our circumstances, he wouldn't want to do it again.
You see,
something very stressful.
In my case, doctor, I was working on a dairy farm, and I helped deliver many calves from the cows. So I kind of followed that principle. Everything seemed to go well,
But as I said, it's something natural. Even if the mother is alone, it will happen. But the help is given when the help is needed. And that's something not obviously common, but sometimes the help is needed.
Any other common problems that spring to mind?
In case the child has fever, very common, many times of the year, child will have a fever, and the mother should know how to handle the fever and the problems which can go along with fever. And the first thing I would like to mention is if the child has fever, the child should receive antipyretic. That means some medicine to bring the fever down. A misnomer many parents and some doctors have is suppository is better than the oral medicines. And as a pediatrician personally, I don't recommend suppositories routinely. They are usually given in case the child is vomiting. If the child is not vomiting, there is no reason whatsoever to give a suppository. Oral medicine has to be given. The reason they feel the suppository is beneficial because the child has no way to resist and spit it out.
Yes, that's right.
It's convenient.
He has no choice.
Right.
Yes. But unfortunately, we've come to the end of the program now. I'd like to thank you very much for coming along. We've covered some very interesting points today, some points of discussion, and you've given us a lot to think about. Thank you also, dear viewers. You've been watching Raising Children. We've been listening to Dr. Nadeem Ahmed Khan, pediatrician, and we hope, inshallah, you'll join us for the next program. I'm your host, Uthman Barry, from Dr. Nadeem and myself. Assalamu alaikum wa rahmatullahi wa barakatuh.
Like every sunrise that brings forth each day, brings new meaning, new hope, a new way. Such is the blessing bestowed upon us. Every hardship and heartache will pass. From the mountains to the